Welcome, future nurses, to NCLEX Practice Test 27. This is not just another set of questions. This is your chance to push your limits, challenge your thinking, and train your brain exactly the way the NCLEX will test you on exam day. Before we move to the next question, I want to speak directly to you. Because if you've been studying for NCLEX but still feeling lost, tired, and unsure whether you're on the right path, then listen carefully. This online NCLEX crash course is exactly the missing link you've been searching for. Right now, it's available at a massive 70% off, and it's the exact same course that has helped more than 10,000 nursing students pass their NCLEX in just one attempt. You're going to get live interactive classes where your doubts are solved instantly, access to recorded lectures so you can revise anytime, crystal clear PDF notes covering every high-yield topic, over 5,000 previously asked NCLEX questions, detailed NGN case discussions with comprehensive explanations, and a step-by-step daily study planner, so you never waste a minute wondering what to read next. This is not just a course. This is a complete NCLEX success system. You've been searching for the right guidance. Here it is. Don't let another exam season pass you by. Click the enrollment link in the description and let's pass NCLEX in one attempt together. So get ready, stay focused, and let's jump straight into NCLEX Practice Test 27 with our first question that is related to a life or death scenario that demands critical thinking in the moment. The nurse is supervising a newly graduated nurse during the resuscitation of an adult in cardiac arrest. Which action by the graduate nurse requires immediate correction to prevent delays in life-saving care? The options are: A. Palpates the carotid artery to assess for a pulse. B. Allows complete chest recoil after each compression. C. Delivers compressions at a depth of 2 inches on the center of the chest. Or D. Waits until completing one cycle of CPR before requesting an automated external defibrillator. The correct answer is option D. Waits until completing one cycle of CPR before requesting an AED. In cardiac arrest, early defibrillation is a key determinant of survival, especially when the rhythm is ventricular fibrillation or pulseless ventricular tachycardia. The AED should be called for and applied immediately after confirming unresponsiveness and absence of a pulse. Waiting until after a full cycle of CPR wastes precious time. Question 2. Moving into a very different but equally important area. Let us discuss prenatal education. During a pregnancy class, the nurse is teaching about nutrition and lifestyle choices. Which client statement shows a misunderstanding that needs further clarification? The options are: A. Since my BMI is normal, I should gain between 25 and 35 pounds during pregnancy. B. I can safely continue to use sugar substitutes like sucralose in moderation. C. Because I am pregnant, I will need to stop following my vegan diet completely. Or D. I will keep my caffeine intake under 200 milligrams daily. The correct answer is option C, believing that veganism must be stopped during pregnancy. This is incorrect because a properly planned vegan diet can meet pregnancy needs if it includes sufficient protein, iron, calcium, vitamin B12, vitamin D, and omega-3 fatty acids. The key is balanced nutrition and supplementation where needed. Question 3. Now shifting gears to an infectious disease scenario. Imagine a client who presents with a recent tick bite and the hallmark bullseye rash of erythema migrans. Which medication should the nurse expect the provider to prescribe? The options are: A. Finasteride, B. Doxycycline, C. Valacyclovir, or D. Diphenhydramine. The correct answer is option B, doxycycline. This tetracycline antibiotic is the first-line treatment for early Lyme disease caused by Borrelia burgdorferi, transmitted by deer ticks. Early treatment prevents later complications such as arthritis, neurological deficits, or carditis. Question 4. Let us turn to a psychiatric intervention scenario. A client is about to undergo electroconvulsive therapy for treatment-resistant depression. Before the procedure, which nursing action is essential for standard safety monitoring? The options are: A. Assess for contrast dye allergy. B. Administer an anticonvulsant. C. Apply a blood pressure cuff. Or D. Check if the client is taking metformin. The correct answer is option C, applying a blood pressure cuff. This is part of mandatory monitoring because ECT can cause temporary increases in blood pressure and heart rate during the seizure. Vital parameters, including heart rate, ECG, oxygen saturation, end-tidal carbon dioxide, and temperature must be closely observed. Question 5. Next, let us move into the realm of immunization science. During a staff education session, the nurse is reviewing vaccine classifications. Which of the following immunizations is an example of a live attenuated vaccine? The options are A. Pneumococcal, B. Diphtheria, tetanus, and pertussis, DTaP, C. Varicella, or D. Hepatitis, B. The correct answer is option C. Varicella. This chickenpox vaccine contains a weakened form of the live virus that triggers an immune response without causing disease in healthy people. Live attenuated vaccines often produce strong, long-lasting immunity, but cannot be given to pregnant clients or those who are immunocompromised due to a small risk of vaccine-induced infection. Examples include measles, mumps, rubella, rotavirus, yellow fever, and intranasal influenza vaccines. Before we move to the next question, I need to talk to you. Yes, you watching right now. I know how much this exam means to you. I know the sleepless nights, the stress, the moments you've doubted yourself, but I also know this. You do not have to go through this alone. Right now, we're offering a massive 70% off on our online NCLEX crash course, the exact program that has helped over 10,000 students pass their NCLEX on the very first attempt. Inside, you'll get live classes where your doubts are solved instantly, recorded sessions you can watch anytime, detailed PDF notes, over 5,000 real NCLEX-style questions, NGN case discussions, and a proven study plan that tells you exactly what to do every single day. I want you to imagine something. The day you see that passing score, the moment you put on that RN or PN badge, the proud smile on your face and on the faces of your family. That moment is closer than you think, but only if you take the right step right now. This is your chance. Don't let fear, hesitation, or procrastination steal your dream. Click the enrollment link in the description, grab your 70% discount, and let's make sure you pass NCLEX in one attempt together. Question 6. Shifting our focus to newborn care. Thermoregulation is one of the nurse's earliest priorities. Immediately after birth, which action best prevents radiant heat loss? The options are A. Drying the newborn skin with a towel, B. Placing the newborn on a padded covered surface, C. Using warmed, humidified oxygen, or D. Positioning the bassinet away from outside windows. The correct answer is option D. Placing the bassinet away from outside windows. Radiant heat loss happens when heat is transferred from the newborn to cooler objects nearby, such as a window pane, even without direct contact. Keeping the baby away from these cold surfaces helps prevent this. Question 7. Let us now discuss a critical care scenario involving septic shock. A client remains hypotensive with a mean arterial pressure of 54 millimeters of mercury, despite receiving a 30 milliliter isotonic fluid bolus. Which infusion should the nurse anticipate next? The options are A. Milrinone, B. Amiodarone, C. Norepinephrine, or D. Lidocaine. The correct answer is option C. Norepinephrine. This first-line vasopressor works by stimulating alpha receptors to constrict blood vessels, increasing vascular tone, and raising the MAP to at least 65 millimeters of mercury to ensure organ perfusion. Question 8. Moving to post-operative endocrine care, 8 hours after a total thyroidectomy, the nurse is prioritizing lab monitoring. Which serum level should be checked to detect a common complication? The options are A. Potassium, B. Calcium, C. Sodium, or D. Glucose. The correct answer is option B. Calcium. Damage to or loss of blood supply to the parathyroid glands during surgery can lead to hypocalcemia within hours to days. Symptoms include perioral numbness, tingling, muscle cramps, tetany, and positive Pfostex or Trousseau's signs. Severe cases may require IV calcium gluconate, while milder cases are managed with oral calcium carbonate. Question 9. Switching now to shock physiology. Consider a client in the compensatory stage of hypovolemic shock after a gastrointestinal bleed. Which findings should the nurse expect? The options are A. Bounding pulses and warm skin, B. Bradycardia with refractory hypotension, C. Tachycardia and cool, clammy extremities, or D. Absent bowel sounds with severe metabolic acidosis. The correct answer is option C. Tachycardia and cool, clammy extremities. This happens because baroreceptors trigger the sympathetic nervous system to release catecholamines, increasing heart rate and causing vasoconstriction to preserve blood flow to vital organs. Blood pressure may still be normal at this stage, but waiting for hypotension would delay intervention. Question 10. Let us revisit cardiovascular anatomy. Which of the following correctly describes the normal blood flow sequence through the heart? The options are A. Superior and inferior vena cava, right atrium, tricuspid valve, right ventricle, pulmonary valve, pulmonary artery, lungs, pulmonary veins, left atrium, mitral valve, left ventricle, aortic valve, aorta, systemic circulation. B. Superior and inferior vena cava, right atrium, mitral valve, right ventricle, pulmonary valve, pulmonary artery, lungs, pulmonary veins, left atrium, tricuspid valve, left ventricle, aortic valve, aorta, systemic circulation. C. Superior and inferior vena cava, right atrium, tricuspid valve, right ventricle, pulmonary valve, pulmonary veins, lungs, pulmonary artery, left atrium, mitral valve, left ventricle, aortic valve, aorta, systemic circulation. D. Superior and inferior vena cava, right atrium, tricuspid valve, right ventricle, aortic valve, pulmonary veins, lungs, pulmonary artery, left atrium, mitral valve, left ventricle, pulmonary valve, aorta, systemic circulation. The correct answer is option A, the true physiological pathway. Deoxygenated blood flows into the right heart, passes to the lungs for gas exchange, and oxygen-rich blood returns to the left heart for systemic distribution. The key pearl is to visualize the path step by step and remember that veins always carry blood toward the heart and arteries carry it away, with the pulmonary vessels being the exception. Question 11 here, with a prenatal care scenario. A client presents for her very first prenatal visit just 2 days after a positive pregnancy test, which means she is only about 3 days late for her period. She asks the nurse when certain tests and procedures will be done. Which assessment is least likely to be completed at this early stage? The options are A. Calculation of body mass index, B. Evaluation of areas prone to edema, C. Fetal Doppler assessment, or D. Pelvic examination. The correct answer is option C. Fetal Doppler assessment. At around 4 to 5 weeks gestation, the embryo is too small for heart tones to be detected by Doppler. Fetal heart sounds typically become audible via Doppler at about 10 to 12 weeks. Question 12. Now shifting focus to airway safety after hospital discharge, a client with a tracheostomy is preparing to go home, and the nurse is reinforcing teaching. Which instruction is most important to emphasize? The options are A. Using lemon glycerin swabs for mouth care, B. Removing old ties before applying new ones, C. Using warm tap water to clean the inner cannula, or D. Wearing a shower shield when bathing. The correct answer is option D. Wearing a shower shield. This prevents water from entering the tracheostomy, which could lead to aspiration, airway compromise, or pneumonia. Question 13. Let us turn to pharmacology. A client has been prescribed tenofovir and emtricitabine. The nurse must recognize these drugs are used to treat which condition? The options are A. Multiple sclerosis, B. HIV, C. Parkinson's disease, or D. Guillain-Barré syndrome. The correct answer is option B. HIV. These medications are nucleoside-nucleotide reverse transcriptase inhibitors used together to suppress viral replication, reduce viral load, and improve CD4 counts. Question 14. Switching gears to environmental safety, the question is, which hazardous gas can be detected in the home using a monitor similar to a smoke detector? The options are A. Ozone, B. Nitrous oxide, C. Carbon monoxide, or D. Carbon dioxide. The correct answer is option C. Carbon monoxide. CO is odorless, colorless, and potentially deadly, and detectors are vital for early warning. Question 15. Moving into clinical assessment, the nurse is evaluating a client for suspected age-related cataracts. Which symptom is most supportive of this diagnosis? The options are A. Peripheral vision loss, B. Central vision loss, C. Difficulty seeing at night, especially while driving, or D. Blurred vision with headache. The correct answer is option C. Difficulty seeing at night. Cataracts cause lens clouding that reduces light transmission, impairing night vision. Option A is incorrect as peripheral loss is linked to glaucoma. Option B is incorrect because central vision loss suggests macular degeneration. Option D is wrong because cataracts are painless. The pearl is that UV protection is a simple prevention measure against cataract progression. Before we move to the next question, I'm going to speak directly to you. And I want you to listen with your full attention. You've been carrying the weight of this NCLEX dream for months, maybe even years. The late nights, the endless notes, the self-doubt that creeps in when you wonder if you're really ready. I know that feeling. But I also know something else. You do not have to do this alone anymore. Right now, our online NCLEX crash course, the exact program that has already helped over 10,000 students pass NCLEX in their first attempt, is available at a massive 70% off. And this isn't just a course. This is a complete step-by-step success system. You'll get live classes where we make sure you understand every single concept, recorded sessions you can rewatch as many times as you need, detailed PDF notes that strip away the fluff and focus only on what matters, over 5,000 real nclex-style questions, NGN case discussions with crystal clear explanations, and a day-by-day study plan that tells you exactly what to do from now until the exam. I want you to picture something right now. It's exam results day. You open the screen and see one word, pass. You feel your chest lighten, your hands shake, and you smile so hard it hurts. Your family sees you and they're smiling too. Proud, relieved, maybe even crying happy tears. That day is real, and it's closer than you think. But it starts with the decision you make today. Don't let hesitation, fear, or procrastination steal your moment. This is your shot. Click the enrollment link in the description, grab your 70% discount, and let's walk this path together. So that NCLEX becomes a story you tell, not a struggle you repeat. Question 16. Now to a metabolic health scenario. A client with prediabetes is being evaluated for treatment success. Which result indicates the goal is being met? The options are A. Total cholesterol 215 mg per deciliter, B. Hemoglobin A1C 5.4%, C. Fasting glucose 128 mg per deciliter, or D. Random glucose to hundreds of milligram per deciliter. The correct answer is option B. Hemoglobin A1C of 5.4%. This is within the normal range and reflects good glycemic control over the past 2 to 3 months. Question 17. Continuing with safety teaching, during a home safety presentation for older adults, the nurse discusses carbon monoxide poisoning. Which statement is correct? The options are A. CO is gray in color, B. CO is clear and odorless, C. Early signs include nosebleeds and tremors, or D. CO smells like rotten eggs. The correct answer is option B. CO is clear and odorless. It binds hemoglobin over 200 times more strongly than oxygen, leading to hypoxia. Question 18. Next, let us consider therapeutic exercise. The nurse observes a client performing isometric exercises. Which action shows correct technique? The options are A. Exercising both extremities together, B. Monitoring heart rate, C. Practicing forced resistance against a stable object, or D. Swinging limbs through a full range of motion. The correct answer is option C. Resistance against a stable object. Isometric exercises strengthen muscles without joint movement, ideal for those with limited mobility. Question: let us address medication side effects. A client on antipsychotic therapy develops akathisia, a restlessness with an urge to move. Which drug should the nurse expect to be prescribed? The options are A. Modafinil, B. Propranolol, C. Venlafaxine, or D. Duloxetine. The correct answer is option B. Propranolol. This non-selective beta blocker is effective for akathisia management. Option A is incorrect as modafinil treats narcolepsy. Option C and D are antidepressants and can even worsen akathisia. The pearl is to recognize extrapyramidal symptoms early so that adjustments or treatments can be made to improve comfort and adherence. Question 20 here, with a focus on home safety, the nurse is assessing an older adult with rheumatoid arthritis. Which recommendation will best promote safety in the bathroom? The options are A. Use a handheld adjustable shower head, B. Lower the toilet seat to its lowest level, C. Reduce bathroom lighting, or D. Use towel racks as grab bars. The correct answer is option A. A handheld adjustable shower head. This allows bathing without excessive bending or twisting, lowering fall risk and joint strain. Option B is incorrect because lowering the toilet seat makes standing more difficult. A raised seat is safer. Option C is unsafe as reduced lighting increases fall risk. Option D is also incorrect because towel racks are not weight-bearing and can break if used for support. Question 21. Moving on to hematology, The nurse is assessing a client undergoing evaluation for possible acute leukemia. Which question is most important? The options are A. Sleeping patterns, B. History of respiratory or other infections, C. Recent weight changes, or D. Recent bowel changes. The correct answer is option B, asking about recent infections. Leukemia impairs white blood cell function, making clients prone to recurrent or prolonged infections. Question 22. Switching now to obstetric emergencies, a client is receiving intravenous oxytocin for labor induction. The nurse observes continuous uterine contractions for the past 5 minutes and a fetal heart rate of 95 beats per minute. What is the priority action? The options are A. Place the client in Trendelenburg, B. Stop the oxytocin infusion, C. Give oxygen via face mask, or D. Increase IV fluids. The correct answer is option B. Stop the oxytocin. Continuous contractions with fetal bradycardia signal uterine tachysystole and fetal oxygen compromise, so halting oxytocin is the first step. Option A is for cord prolapse, option C is a follow-up after stopping oxytocin, and option D will not correct the problem if oxytocin continues. Question 23. Let us now turn to an eye emergency. A client presents with a suspected retinal detachment. Which symptom would not be expected? The options are A. Floaters, B. Curtain over part of vision, C. Flashes of light, or D. Intense eye pain. The correct answer is option D. Intense eye pain. Retinal detachment is typically painless. Common symptoms include floaters, flashes of light, and a shadow or curtain effect. Option A, B, and C are all classic signs. Question 24. In this next emergency scenario, a client arrives in the emergency department after a high-voltage electrical burn. Which lab should be monitored most closely for complications? The options are A. Creatine phosphokinase, B. White blood cells, C. Serum lipase, or D. Serum glucose. The correct answer is option A. Creatine phosphokinase, CK. High-voltage burns can cause massive muscle breakdown, rhabdomyolysis, releasing myoglobin that can damage the kidneys. Option B is relevant for infection, but not the immediate threat. Option C is related to pancreatitis, and option D can be affected, but is not the primary concern. Question 25. Now focusing on evidence-based practice, the nurse is reviewing literature to guide clinical decisions. Which study type provides the most reliable, high-quality evidence? The options are A. Systematic review and meta-analysis, B. Expert opinion, C. Qualitative studies, or D. Case studies. The correct answer is option A. Systematic reviews and meta-analyses. These combine and analyze results from multiple high-quality studies, reducing bias and summarizing the best available evidence. Option B is at the base of the evidence hierarchy. Option C provides valuable perspective, but not statistical strength for practice guidelines. Option D is anecdotal and lacks generalizability. Before we go to the next question, I need you to pause for just a moment, because what I'm about to say could be the difference between you passing, NCLEX this time, or facing it all over again. You've already invested your time, your energy, your heart into this dream. You've stayed up late, you've given up weekends, you've told yourself, this time I have to make it. But deep down, you know something. What you've been doing isn't enough, and that's okay, because now, you've just found the one thing that can change everything. Right now, and I mean right now, our online NCLEX crash course is open at a massive 70% off. And this is not just any course. This is the proven system that has already taken over 10,000 students from anxious and unsure to passing NCLEX in one attempt. Here's what you're walking into. Live interactive classes where your questions get solved instantly. Recorded sessions you can rewatch anytime you need. Detailed PDF notes that cut out the fluff. Over 5,000 real nclex-style questions. NGN case discussions broken down in simple steps. And a day-by-day study planner, so you'll never waste a single moment wondering what to study next. Now here's the truth. This offer will not stay forever. And every single day you wait is another day closer to your exam without the right preparation. Every day you wait increases the risk that you'll be standing here again, months from now, starting over. So I want you to picture something. You on results day. You open your screen and you see PASS. You can feel your shoulders drop, your heart racing, but in a good way this time. You hug your family, they're crying happy tears, and deep inside, that this one decision changed your entire future. That's the decision you're about to make right now. Click the link in the description, grab your 70% discount. Let's make sure that this is the last time you ever prepare for NCLEX, and the first day you step into your life as an RN or PN. Question 26. A client with diabetes and hypertension presents with altered mental status. Which provider order should the nurse question? The options are A. Urine analysis, B. Head CT, C. Regular diet, or D. Ammonia level. The correct answer is option C. Regular diet. This is inappropriate for a client with both diabetes and hypertension, as sodium and carbohydrate control are essential. Option A is appropriate to detect infection as a reversible cause. Option B is appropriate to rule out stroke or other structural brain causes. Option D is appropriate to evaluate metabolic encephalopathy. Question 27. Let us review this set with a post-stroke emergency. A client suddenly develops a fixed and dilated pupil. Which action should the nurse take immediately? The options are A. Reduce environmental stimuli, B. Reassess after 10 minutes, C. Check the client's blood pressure, or D. Notify the physician. The correct answer is option D. Notify the physician. A sudden fixed and dilated pupil suggests acute increased intracranial pressure with possible transtentorial herniation, a neurological emergency that requires rapid intervention. Option A may help with mild ICP elevations, but is not the priority here. Option B wastes valuable time. An irreversible brain injury can occur within minutes. Option C is part of the assessment but does not replace the urgent need to call the provider. The Pearl: any abrupt neurological change post-stroke means immediate action. Time truly is brain. Question 28. Now moving into postpartum care, a breastfeeding client 2 days after delivery reports uterine cramping while feeding. What is the best nursing response? The options are A. Perform a vaginal exam, B. Prepare for a pelvic ultrasound, C. Reassure the client this is normal, or D. Advise bottle feeding until cramping stops. The correct answer is option C. Reassure the client this is normal. Breastfeeding stimulates oxytocin release, which contracts the uterus to return it to its pre-pregnancy size. Option A and B are not necessary unless abnormal symptoms appear, and option D would hinder breastfeeding success. Question 29. Let us switch to diabetes education. The nurse is teaching a client newly prescribed rapid-acting insulin. Which statement is correct to include? The options are A. Discard the vial 25 days after opening, B. Inject 20 to 30 minutes before meals, C. Inject while actively eating, or D. Inject at bedtime to prevent overnight spikes. The correct answer is option C. Inject while eating. Rapid-acting insulins such as Lispro, Aspart, or Glulisine should be given within 5 to 10 minutes of starting a meal to match their quick onset and avoid hypoglycemia. Option A is wrong because insulin remains stable for 28 days at room temperature. Option B describes short-acting insulin timing, and option D risks dangerous overnight hypoglycemia. Question 30. Next, let us prioritize care decisions. Which client should be assessed first? The options are A. Chest pain 14 hours ago with normal troponin, B. SIADH with new disorientation, C. Acute kidney injury with low urine output, or D. Post-laparoscopic cholecystectomy with shoulder pain. The correct answer is option B. SIADH with new disorientation. This suggests acute hyponatremia, which can rapidly lead to seizures, coma, or death. Option A is stable, option C is expected in AKI's oliguric phase, and option D is due to harmless residual gas after surgery. Question 31. Let us consider medication safety. A neurology clinic nurse is caring for several clients on phenytoin. Which client is most at risk for toxicity? The options are A. Hypertension on thiazide diuretic, B. Malnourished on a bisphosphonate, C. Smoker on azithromycin, or D. Diabetes starting insulin. The correct answer is option B. Malnourished on a bisphosphonate. Phenytoin is highly protein-bound, and low albumin increases the free active drug level, causing toxicity even with normal total levels. Option A has no significant impact, option C's smoking lowers phenytoin levels, and option D is unrelated. Question 32. Now turning to psychiatric medications, a client prescribed risperidone makes the statement, I will need weekly white blood cell tests. What should the nurse do? The options are A. Report abnormal movements. B. Correct this misunderstanding. C. Report muscle stiffness. Or D. Chew sugarless gum for dry mouth. The correct answer is option B. Correct the misunderstanding. Weekly WBC monitoring is for clozapine, not risperidone. Option A is accurate advice. Option C addresses urgent EPS or NMS, and option D is appropriate for dry mouth. Question 33. Switching to leadership concepts, the nurse manager creates a unit-based council for shared decision-making. Which leadership style is this? The options are A. Authoritative, B. Democratic, C. Laissez-faire, or D. Transactional. The correct answer is option B. Democratic. This style encourages participation and shared responsibility. Option A is top-down decision-making. Option C is hands-off, and option D is performance-reward focused. Question 34. In the surgical setting, the nurse documents a client lying flat with the head lower than the feet at a 15 to 30 degree incline. Which position is this? The options are A. Prone, B. Supine, C. Trendelenburg, or D. Sims. The correct answer is option C. Trendelenburg position. This increases venous return and is useful for certain procedures, hypotension, and preventing air embolism during central line placement. Option A is lying face down, option B is lying flat face up, and option D is side lying. Question 35. Moving to conflict resolution in nursing, the educator explains that compromise may lead to which outcome? The options are A. Incomplete satisfaction for both parties, B. Appeasing through self-sacrifice, C. Suppressing thoughts, or D. Satisfying one side only. The correct answer is option A. Incomplete satisfaction for both parties. Compromise is a partial win for each side. Unlike collaboration, which fully satisfies both, option B describes accommodating, option C is avoiding, and option D is competing. Before we move to the next question, I need you to stop and really listen, because what I'm about to say could be the single reason you pass the NCLEX on your very next attempt, or end up right back here, repeating the same cycle of stress, anxiety, and disappointment. You've already sacrificed so much for this dream. You've stayed awake when everyone else slept. You've skipped outings, given up weekends, and told yourself, this time I must pass. But if you're being honest with yourself, deep down, you know what you've been doing isn't enough to guarantee it. And that's okay, because now you've just stumbled upon the exact thing that can change everything. Right now, and I mean right now, our online NCLEX crash course is open for enrollment at an unbelievable 70% off. And this isn't just another study resource. This is the same proven system that has taken over 10,000 students from confused and terrified to passing the NCLEX in one single attempt. Here's what you'll get the moment you join. Live interactive classes where your doubts are cleared instantly. Lifetime access to recorded sessions so you can rewatch anytime. Crystal clear PDF notes that cut the fluff and give you exactly what you need. Over 5,000 real nclex-style practice questions to master every concept. Step-by-step and case study breakdowns, so you're never lost. A daily study planner, so you always know exactly what to do next. But here's the hard truth. Every single day you wait is a day closer to your exam without the right preparation. Every day you wait increases the risk of failing, losing more time, more money, and more confidence. So close your eyes for a second and imagine it's results day. You open the screen. It says, pass. Your heart is pounding, your shoulders drop in relief, and tears of joy fill your eyes. You hug your family. They're smiling, crying, and telling you how proud they are. And you know, in that exact moment, that this one decision changed the entire course of your life. That moment starts here. It starts now. Click the link, claim your 70% discount. Make this the last time you ever have to prepare for NCLEX. And the first day you step into your career as a licensed RN or PN. Let's move to next question. In preparing a client for thoracentesis, which position is preferred? The options are A. Sitting up leaning over a bedside table, B. Lying flat on the unaffected side, C. Prone with arms extended overhead, or D. Head elevated 45 degrees lying on the affected side. The correct answer is option A. Sitting up leaning over a table with feet supported. This allows the ribs to spread and the intercostal spaces to open for safe fluid removal. Options B and D limit access, and option C is not used for this procedure. Question 37. We begin this set with psychiatric nursing principles. The nurse educator is shadowing a student caring for a psychiatric client and asks, which factor forms the true foundation of a therapeutic nurse-client relationship? The options are A, a sincere desire to help others, B, acceptance, C, understanding and self-awareness, or D, knowledge of psychiatric nursing. The correct answer is option C, understanding and self-awareness. This skill allows the nurse to recognize and manage their own beliefs, values, and biases, ensuring objectivity in communication. Option A is valuable but not sufficient without self-awareness. Option B stems from self-awareness rather than standing alone. Option D, while important, cannot replace the role of self-awareness in building therapeutic trust. Question 38. Now let's shift to newborn care. The nurse is teaching about thermoregulation and asks, which action prevents evaporative heat loss? The options are A, drying the newborn's skin with a towel after a bath, B, skin-to-skin contact with a parent, C, warming the stethoscope before auscultation, or D, keeping the nursery temperature at 22 to 26 degrees Celsius. The correct answer is option A, drying the skin promptly. Evaporative heat loss happens when moisture turns to vapor, carrying heat away from the body. Option B and C prevent conductive loss, while option D prevents convective loss. Question 39. Let's move into a triage scenario. The nurse is taking phone calls for a provider. Which report needs immediate follow-up? The options are A, bilateral flank pain with 2 nephrostomy tubes, B, abdominal cramping during peritoneal dialysis, C, facial edema with nephrotic syndrome, or D, localized rash after taking ciprofloxacin. The correct answer is option A, bilateral flank pain with nephrostomy tubes. This may indicate pyelonephritis, which can progress quickly to sepsis. Option B is usually managed by slowing infusion and warming the dialysate. Option C is expected with nephrotic syndrome. Option D may indicate a mild allergic reaction but is less urgent than a potential renal infection. Question 40. Switching to pediatric nephrology, a child with acute glomerulonephritis is being assessed. Which finding is most likely? The options are A, urine-specific gravity 1.004, B, proteinuria, C, urinary incontinence, or D, hypotension. The correct answer is option B, proteinuria. AGN causes glomerular inflammation that allows protein and red blood cells to leak into the urine, often giving it a tea or cola-colored appearance. Option A is incorrect because urine-specific gravity is usually high from fluid retention. Option C is not typical. Oliguria is more common. Option D is wrong because hypertension, not hypotension, occurs due to fluid retention. Question 41. Let's look at congenital GI disorders. Parents of a 2-year-old with Hirschsprung's disease ask about the treatment of choice. The options are A, colostomy, B, senna concentrate, C, polyethylene glycol, or D, pull-through procedure. The correct answer is option D, pull-through procedure. This surgery removes the affected colon segment lacking ganglion cells and connects healthy bowel to the anus. Option A may be a temporary step but is not curative. Option B and C cannot correct the underlying nerve absence. The pearl. No ganglion equals no go. Surgery is the only cure. Question 42. Now for a GI assessment review. Which condition is associated with hyperactive bowel sounds? The options are A, paralytic ileus, B, gastroenteritis, C, late bowel obstruction, or D, peritonitis. The correct answer is option B, gastroenteritis. Irritation increases peristalsis, producing hyperactive, high-pitched sounds and diarrhea. Option A, C, and D all cause hypoactive or absent sounds. The pearl, hyperactive sounds point to diarrhea diseases, while hypoactive means post-op, peritonitis, or paralysis. Question 43. Let's address mobility safety. Improper crutch use can lead to which complication? The options are A, axillary nerve damage, B, solar plexus nerve damage, C, carpal tunnel syndrome, or D, trigeminal nerve damage. The correct answer is option A, axillary nerve damage from brachial plexus compression. This causes weakness, numbness, or paralysis in the arm. The other options involve unrelated nerves or mechanisms. The pearl, crutches, strikes elbows and hands, not armpits. Question 44. Here we have a priority assessment scenario. Which client should be assessed first? The options are A. Stage 3 pressure ulcer with pseudomonas. B. 3 hours post-ileostomy with red edematous stoma. C. Type 2 diabetic with fasting glucose 76 mg per deciliter refusing breakfast. Or D. Awaiting appendectomy with pain relief by bending the right hip. The correct answer is option D. Appendicitis with pain relief and hip flexion. This suggests perforation with peritonitis, which can rapidly lead to sepsis. Option A is not immediately life-threatening. Option B is an expected post-op finding. Option C is low normal glucose and needs follow-up but is not emergent. Question 45. Let us begin this section with a patient rights scenario in behavioral health. While observing on a psychiatric unit, which practice should the nurse question? The options are A. Opening all clients' postal packages before giving them to the client. B. Explaining the formal complaint process. C. Allowing clients to make private phone calls. Or D. Allowing involuntarily admitted clients to refuse medications. The correct answer is option A. Opening all clients' packages without cause. Clients have the right to receive unopened mail unless there is a safety reason for inspection. And if inspection is required, the client must be present. Option B is appropriate, as clients should know how to file complaints. Option C protects private communication unless safety restrictions apply. Option D is accurate. Involuntary admission does not remove the right to refuse medications without a court order. Stop scrolling. Listen. If you're preparing for NCLEX, what I'm about to say could be the difference between passing in one attempt or wasting months, money, and confidence starting over. Right now, our online NCLEX crash course, the same system that's helped over 10,000 students pass, is open at a massive 70% off. You're getting live classes, recorded replays, 5,000 plus NCLEX-style questions, NGN breakdowns, and a daily study plan so you'll never waste a single hour. But here's the catch. This offer disappears soon. Wait even one more day, and you could be facing the NCLEX without the right preparation and risking failure. Picture results day. You see pass on your screen, tears in your eyes, your family hugging you, because you made this decision today. Click now, grab your 70% discount. Make this the last time you ever prepare for NCLEX. Question 46. Now shifting to mobility safety, a client with left-sided weakness is being discharged with a cane. Which instruction is correct? The options are A. Advance the cane with the stronger leg. B. Remove the rubber tip when climbing stairs. C. Adjust cane height to elbow level. Or D. Hold the cane in the right hand. The correct answer is option D. Hold the cane in the right hand. A cane should always be used on the side opposite the weakness for maximum stability. Option A is wrong because the cane moves with the weaker leg, not the stronger one. Option B is unsafe, as the rubber tip prevents slipping. Option C is inaccurate because the cane should be adjusted to the greater trochanter or wrist crease, not the elbow. Question 47. Let's talk about oxygen safety during transport. When taking a client on oxygen using a portable cylinder, what is the nurse's first action? The options are A. Check oxygen level before transport. B. Use a cylinder with 500 pounds per square inch remaining. C. Place cylinder on stretcher next to the client. Or D. Turn the cylinder key counterclockwise to stop flow. The correct answer is option A. Check the oxygen level before moving the client. Running out of oxygen mid-transfer can be life-threatening. Option B is unsafe, as 500 pounds per square inch is too low for safe transport. Option C risks injury because the cylinder must be secured upright. Option D is incorrect. To stop flow, the valve is turned clockwise. Question 48. Next, let's revisit pediatric surgery teaching. The nurse is instructing a group about Hirschsprung's disease. Which treatment is considered the definitive management? The options are A. Surgical repair such as colectomy. B. Lifelong pancreatic enzyme supplementation. C. Gluten-free diet. Or D. Fecal microbiota transplant. The correct answer is option A. Surgical removal of the affected bowel segment and reconnection to healthy bowel, often through a pull-through procedure. Option B is for cystic fibrosis. Option C is for celiac disease. And option D treats recurrent Clostridioides difficile infection. Question 49. Turning to prenatal testing, the nurse is educating a pregnant client about a non-stress test. Which client statement needs correction? The options are A. I cannot have anything to eat 8 hours prior to this test. B. I will have an external monitor across my abdomen. C. A reactive result means my baby is doing well. Or D. If this test is abnormal, I will need further testing. The correct answer is option A. Fasting is not required for an NST. Option B is correct, as the monitor is external. Option C is correct because a reactive result is reassuring. Option D is correct, as abnormal results usually prompt additional tests. Question 50. Now into cardiac rhythm interpretation. The nurse reviews an ECG strip showing no distinct P waves, an irregularly irregular rhythm, and fibrillatory baseline activity. What is the rhythm? The options are A. Sinus bradycardia, B. Normal sinus rhythm with first-degree AV block, C. Atrial flutter, or D. Atrial fibrillation. The correct answer is option D. Atrial fibrillation. It features chaotic atrial activity and irregular ventricular response. Option A has regular P waves with slow rate, option B has prolonged PR intervals, and option C has sawtooth flutter waves. Question 51. Let's address seizure management. The nurse witnesses a tonic-clonic seizure. What is the priority action? The options are A. Call a code blue, B. Note the start time, C. Step out to get side rail pads, or D. Elevate the head of bed. The correct answer is option B. Note the start time. Timing is essential to identify status epilepticus, which requires urgent treatment. Option A is for cardiac arrest, not seizure activity. Option C is unsafe. Do not leave the client. Option D is not the priority. Instead, position the client on their side. Question 52. Let's review infant resuscitation basics. A 1-month-old infant is suspected to be in cardiac arrest. Which pulse height should the nurse check? The options are A. Brachial, B. Femoral, C. Carotid, or D. Popliteal. The correct answer is option A. The brachial artery, located on the inside of the upper arm, is recommended for infants under 1 year. Option B is used in some cases but is not standard in emergencies. Option C is for older children and adults. Option D is impractical in resuscitation. The Pearl, infant CPR equals brachial pulse check, 2 thumb or 2 finger compressions, 100 to 120 per minute. Question 53, let us see with pain perception. When educating nursing students, which statement is most accurate? The options are A. Allodynia is the absence of pain when a painful stimulus is applied. B. There is no scientific evidence of pain during neonatal circumcision. C. Hyperalgesia is the opposite of hyperpathia. Or D. The perception of pain and its impact vary greatly among individuals. The correct answer is option D. Pain perception is highly subjective and influenced by multiple factors such as age, culture, emotional state, and genetics. Option A is wrong because allodynia refers to pain from a normally non-painful stimulus. Option B is incorrect, as strong evidence shows neonatal circumcision is painful. Option C is wrong because hyperalgesia and hyperpathia are related but not opposites. The Pearl, the client's word remains the gold standard in pain assessment. Question 54. Shifting to ENT care, a client using over-the-counter nasal decongestant drops daily for more than a week reports worsening nasal congestion. What should the nurse instruct? The options are A. Discontinue the medication for several days, B. Combine oral decongestants, C. Switch to a stronger formula, or D. Increase frequency. The correct answer is option A. Stop the medication. Prolonged use beyond 3 to 5 days can cause rebound congestion, known as rhinitis medicamentosa. Option B risks more side effects without resolving the problem. Option C and D will worsen the condition. The Pearl, remember the 3 to 5 day rule. Beyond this, nasal sprays can flip from relief to worsening congestion. Question 55. Next, let us address urinary incontinence. A client with urge incontinence asks for help. Which nursing intervention is most appropriate? The options are A. Prophylactic antibiotics, B. Intermittent self-catheterization, C. Timed voiding, or D. Encourage caffeinated beverages. The correct answer is option C. Timed voiding, which retrains the bladder and reduces urgency. Option A is for recurrent infections, not urgency. Option B is for retention. Option D worsens urgency because caffeine irritates the bladder. The Pearl, urge incontinence management includes bladder training, avoiding irritants, and pelvic floor exercises. Wait, before you skip this, ask yourself one question. Are you 100% sure you'll pass NCLEX on your next try? If your answer is anything less than absolutely, then you need this. Our online NCLEX crash course, the same system that's helped 10,000 plus students pass in one attempt, is now 70% off for a very limited time. You'll get live classes, instant doubt solving, 5,000 plus nclex-style questions, NGN case breakdowns, and a day-by-day study plan so you never waste time guessing what to do next. But here's the truth. Every day you wait is one step closer to failing and starting over. Don't let that happen. Imagine results day. Your screen says pass, your family is crying tears of joy, and your life changes forever. Click now. Grab your 70% discount. Make this the last time you study for NCLEX. Question 56. Let us move into women's health. A client is scheduled for a pelvic exam next week. Which pre-procedure instruction should the nurse provide? The options are A. Local anesthesia will be used. B. Clench fist during speculum insertion. C. Avoid dushing for at least 24 hours. Or D. Open mouth wide when speculum is inserted. The correct answer is option C. Avoid dushing, as it removes normal flora and epithelial cells, leading to inaccurate results. Option A is incorrect because anesthesia is not needed for routine exams. Option B increases discomfort by tightening pelvic muscles. Option D is misleading. Relaxation techniques are better explained as gentle breathing rather than opening the mouth wide. The Pearl, clear, step-by-step explanations reduce pelvic exam anxiety. Question 57. Turning to skin care. During an assessment, a nurse notes redness over bony prominences despite the client reporting no special skin needs. What is the next best action? The options are A. Document and continue routine care. B. Apply topical antibiotic. C. Perform an emergency assessment. Or D. Perform and document a focused skin integrity assessment. The correct answer is option D. A focused assessment helps stage any early pressure injury and initiate prevention. Option A risks missing early intervention. Option B is unnecessary unless infection is present. Option C is not warranted unless systemic symptoms occur. The Pearl, Stage 1. Pressure injuries are non-blanchable erythema. Early recognition prevents ulcer progression. Question 58. Now to gastrointestinal health. A client with diverticulosis reports difficulty meeting fiber goals. Which order should the nurse anticipate? The options are A. Psyllium, B. Oil retention enema, C. Codeine, or D. Bisacodyl. The correct answer is option A. Psyllium, a bulk-forming laxative that softens stool and reduces colonic pressure. Option B is not used routinely and may raise perforation risk. Option C slows motility, increasing constipation risk. Option D is a stimulant laxative, not first line for diverticulosis. The Pearl, fiber must be paired with adequate fluids to prevent worsening constipation. Question 59. Let us review safe medication practices. A nurse is reviewing home medication routines with a client on antihypertensives. Which statement needs follow-up? The options are A. My pulse decreases after taking metoprolol. B. I take my furosemide before sleep. C. I season food with salt substitutes while on hydrochlorothiazide. Or D. I wear my clonidine patch for 7 days. The correct answer is option B. Taking furosemide before bed increases nocturia and fall risk. Option A is expected unless symptomatic bradycardia occurs. Option C can be acceptable but requires provider guidance on potassium levels. Option D is correct for clonidine patch use. The Pearl, medication timing is essential. Loop diuretics in the morning, beta blockers with heart rate monitoring, patches as prescribed. Question 60. Let us continue segment with post-procedure care. A nurse is caring for a client after a femoral angiography with contrast dye. Which nursing action belongs in the plan of care? The options are A. Encourage ambulation within 1 hour. B. Discontinue intravenous fluids. C. Assess kidney function the next day. Or D. Keep the client NPO for 4 hours. The correct answer is option C. Kidney function must be assessed because contrast dye is excreted through the kidneys, and contrast-induced nephropathy or acute kidney injury can develop. Option A is unsafe because the leg must remain straight to prevent bleeding. Option B is incorrect because intravenous fluids help flush the dye. Option D is unnecessary unless oral intake is restricted for another reason. The Pearl. After any contrast procedure, Hydration before and after is your best defense against kidney injury. Question 61. Now let us move to the legal and ethical domain. A client insists on leaving the hospital against medical advice, and the nurse physically blocks the doorway. Which legal violation has occurred? The options are A. False imprisonment, B. Malpractice, C. Negligence, or D. Invasion of privacy. The correct answer is option A. False imprisonment, which happens when a competent adult is unlawfully restrained or prevented from leaving. Option B applies only if harm occurs from professional negligence. Option C is failure to act reasonably, but does not involve restraint. Option D involves unauthorized sharing of private information. The Pearl. When a client wishes to leave AMA, educate on risks, document the discussion, have the client sign AMA forms, but never physically prevent them without legal authority. Question 62. Shifting to dermatologic pharmacology, a nurse is preparing to start isotretinoin therapy for severe acne in a female client. Which lab test is most critical before treatment begins? The options are A. Pregnancy test, B. C-reactive protein, C. Blood urea nitrogen and creatinine, or D. Prothrombin time. The correct answer is option A. A pregnancy test is mandatory because isotretinoin is highly teratogenic. Option B has no role here. Option C checks kidney function, but is not a primary requirement for isotretinoin. Option D assesses clotting and is unrelated to acne treatment. The Pearl. For isotretinoin, remember PPP. Pregnancy test, protection with 2 contraceptives, and periodic monitoring of liver function and triglycerides. Question 63. Next, let us look at procedural sequencing. The nurse is about to give a cleansing enema to a constipated client. Which steps come first to last? The correct order is explain the procedure and position the client on the left side. Fill the enema bag, prime and clamp the tubing, lubricate the tip, insert the applicator, release the clamp, and finally, remove the applicator after infusion. This sequence ensures the client understands the procedure, equipment is ready, tissue trauma is minimized, and solution flows smoothly. The Pearl. Explain, prepare, protect. Gain cooperation, set up completely, and protect mucosa with lubrication and gentle handling. Question 64. Moving on to skin integrity. A nurse is assessing a client at high risk for pressure ulcers. Which of the following is an intrinsic factor? The options are A. Shearing, B. Friction, C. Impaired tissue perfusion, or D. Pressure. The correct answer is option C. Impaired tissue perfusion, an internal condition that reduces oxygen delivery and slows healing. Options A, B, and D are extrinsic factors involving external forces. The Pearl. Think intrinsic bias inside, such as circulation and nutrition, and extrinsic sign environment, such as friction, pressure, and shearing. Question 65. Now to a mental health setting. A nurse is preparing a client for electroconvulsive therapy. Which medication should be questioned? The options are A. Venlafaxine, B. Esomeprazole, C. Topiramate, or D. Lurasidone. The correct answer is option C. Topiramate is an anticonvulsant and raises the seizure threshold, reducing ECT effectiveness. Option A can be continued. Option B is used to reduce aspiration risk. Option D may complement ECT in psychiatric treatment. The Pearl. Before ECT, avoid seizure-suppressing drugs like anticonvulsants or high-dose benzodiazepines unless specifically ordered. Feeling overwhelmed by NCLEX prep? We will take you from confused to confident. Our package includes live interactive classes, 100 hours of animated crash courses, and 500 hours of recorded lectures you can watch anytime. You will master 500 Nigerian Naira questions, explain step-by-step and tackle 5,000 previous NCLEX questions. You will train with 15 CAT mock tests, learn from an exclusive NCLEX ebook, and follow our custom study planners for 1 week, 1 month, or 3 months. Add in PDF notes for last-minute review and 1 year full access, and you have got the winning formula. Enroll now. Link below. Question 66. Switching to critical care, a nurse is caring for a mechanically ventilated client. Which emergency device must always be at the bedside? The options are A. Bag valve mask, B. Nasal cannula, C. Chest tube, or D. Tracheostomy set. The correct answer is option A. A bag valve mask for immediate manual ventilation during equipment failure or accidental extubation. Option B cannot sustain ventilation needs. Option C is not required unless a pneumothorax occurs. Option D is needed only in specific surgical situations. The Pearl, BVM at the bedside is a universal safety rule for ventilated patients. Question 67. Let us review neutropenic precautions. The nurse is teaching a female client about infection prevention. Which recommendation is most appropriate? The options are A. Brush teeth every other day. B. Use pads instead of tampons. C. Wear a face shield in public. Or D. Disinfect home surfaces with hot water. The correct answer is option B. Pads reduce mucosal injury and infection risk compared to tampons. Option A is unsafe. Oral hygiene must be maintained twice daily with a soft brush. Option C is incomplete protection. A surgical mask is preferred. Option D is ineffective. Hot water alone will not kill pathogens. The Pearl. Protect every portal. Avoid mucosal injury, keep oral hygiene, and disinfect properly in neutropenia. Question 68. Let us start with a case from obstetrics. A 28-week pregnant first-time mother with type A Rh negative blood is scheduled for Rho D immune globulin today. Which statement signals she needs more teaching? The options are A. This shot is meant to prevent my baby from developing antibodies against my blood. B. If my baby is Rh positive, I will need another shot after delivery. C. This protects future pregnancies, but each pregnancy will require a new dose. Or D. This will prevent me from making Rh antibodies. The correct answer is option A. ROD, immune globulin, prevents the mother from developing antibodies against Rh-positive fetal blood, not the baby from making antibodies. Option B is accurate because most blood mixing happens at delivery, so a second postpartum dose is needed if the newborn is Rh positive. Option C is correct since protection applies to only the current pregnancy. Option D is also true because the injection prevents maternal sensitization. The Pearl, Rogum protects mom from attacking the baby's red blood cells. Given at 26 to 28 weeks, and again postpartum if the baby is Rh positive. Question 69. Now we turn to perioperative safety in older adults. A nurse attends an education session on intraoperative positioning. Which statement requires follow-up? The options are A. Warming devices help prevent hypothermia. B. The client's head and feet should be covered during surgery. C. Clients should be slid, not lifted, into position. Or D. Extra padding helps protect skin in clients with poor circulation. The correct answer is option C. Sliding creates friction and shear injuries, which are particularly dangerous for older adults with fragile skin and poor circulation. Option A is correct because warming devices maintain body temperature. Option B is correct since covering the head and feet reduces heat loss. Option D is correct because padding helps distribute pressure evenly and prevents ischemia. The Pearl, in older adults, lift, do not slide, to prevent skin tears and pressure injuries. Question 70. Let us move into cardiac pharmacology. The nurse is preparing to give amiodarone. Which lab test requires regular monitoring during this therapy? The options are A. White blood cell count, B. Serum glucose level, C. Serum uric acid level, or D. Thyroid stimulating hormone level. The correct answer is option D. Amiodarone contains iodine and can cause both hypo and hyperthyroidism by altering thyroid hormone production and conversion, making TSH monitoring essential. Option A is irrelevant unless using drugs with agranulocytosis risk. Option B is unrelated unless other glucose-affecting drugs are present. Option C is not linked to amiodarone but to gout and uric acid-altering medications. The Pearl. With amiodarone, monitor thyroid, liver, and lungs. TSH, liver enzymes, and pulmonary function tests are all part of safe therapy. Question 71. Let us address therapeutic communication in newborn care. A parent is crying after learning their newborn has an omphalocele and says, "I cannot believe my baby was born this way. He will surely die." Which nurse response is most therapeutic? The options are A. Do not worry. These things happen all the time. Your baby will be fine without any intervention. B. I understand you are upset. This is certainly serious, but there is a treatment that can repair the omphalocele, and we will take excellent care of your baby. C. I know this looks bad, but let us not jump to conclusions. We will see how it goes. Or D. I understand you must be upset. Would you like to hold your baby while he is still here? The correct answer is option B. It acknowledges the parent's emotions, provides accurate information, and offers realistic hope. Option A dismisses their feelings and offers false reassurance. Option C minimizes the situation without educating the parent. Option D reinforces fear of death without correcting misinformation. The pearl, therapeutic communication means validating emotion, giving accurate facts, and offering hope when realistic. Question 72. Let us switch with a medication administration scenario focused on timing with meals. The nurse attends a continuing education session on drug scheduling. Which statement shows correct understanding? The options are A. Proton pump inhibitors should be given as the client eats breakfast. B. Glucocorticoids should be taken on an empty stomach to prevent gastrointestinal irritation. C. Rapid-acting insulin should be administered approximately 5 to 10 minutes before meals. Or D. Levodopa-carbidopa should be administered with a high-protein snack to enhance absorption. The correct answer is option C. Rapid-acting insulins such as Lispro, Aspart, and Glulicine should be given just before eating, within 5 to 10 minutes, to match the body's post-meal glucose rise and avoid hypoglycemia. Option A is incorrect because proton pump inhibitors work best when taken 30 minutes before meals. Option B is incorrect because glucocorticoids should be taken with food, not on an empty stomach, to minimize gastric irritation. Option D is incorrect because levodopa-carbidopa should be taken on an empty stomach to improve absorption and avoid protein competition at the blood-brain barrier. The pearl. Always match medication pharmacokinetics to mealtime for maximum benefit and safety. Question 73. Shifting to ophthalmology, let us talk about functional impact. An older adult recently diagnosed with cataracts is receiving discharge teaching. Which statement shows correct understanding of how this condition affects daily life? The options are A. I may have to quit driving until I get the cataracts treated. B. I should spend less time outdoors in the sun and plan more activities at night. C. I will need to avoid activities that raise my intraocular pressure, such as bending at the waist. Or D. I will have to be careful since my eyes will not move together. The correct answer is option A. Cataracts cause gradual lens opacification, producing glare sensitivity and blurry vision that can make driving hazardous, especially when reading road signs or detecting distant objects. Option B is not accurate since daytime activities are not restricted. In fact, night driving is usually more difficult. Option C is incorrect because intraocular pressure concerns apply to glaucoma, not cataracts, and bending precautions apply only after cataract surgery. Option D is incorrect because cataracts do not affect eye muscle movement. The pearl, cataract symptoms often first affect night driving and glare tolerance, before severe daytime vision loss develops. Question 74. Now let us walk through a procedural skill, obtaining a capillary blood glucose reading. Here are the steps provided, and your task is to place them in order. 1. Hold gauze on the finger after the specimen is taken. 2. Turn the finger downward. 3. Insert the strip into the meter. 4. Prick the side of the finger. 5. Verify that the strip code matches the meter. 6. Clean the finger with alcohol and let it dry. 7. Read the result. 8. Collect the blood on the strip. The correct sequence is Step 5. Match the code for accurate calibration. Step 3. Insert the strip so the device is ready. Step 6. Swab with alcohol and allow it to dry. Step 2. Lower the finger to use gravity for blood flow. Step 4. Puncture the side of the fingertip to reduce discomfort. Step 8. Collect the blood without squeezing excessively. Step 1. Apply gauze to stop bleeding. And Step 7. Read and document the result. The pearl. Avoid milking the finger. Excessive squeezing can mix tissue fluid with blood, falsely lowering the reading. Question 75. And now, I am ending this session with our last scenario related to cardiac monitoring and urgent priorities. The nurse reviews telemetry strips for assigned clients. Which situation requires immediate notification of the primary healthcare provider? The options are A. A client in normal sinus rhythm with 3 PVCs in the last hour. B. A client recovering from cardiac catheterization who has had 2 brief runs of ventricular tachycardia. C. A client with atrial fibrillation whose rate decreased from 113 to 95. Or D. A client who developed sinus tachycardia after nitroglycerin paste application. The correct answer is option B, post-catheterization. Any ventricular tachycardia is a red flag arrhythmia that can deteriorate into ventricular fibrillation. And even short, self-terminating runs require immediate reporting. Option A is generally benign and less frequent or symptomatic. Option C reflects improved rate control, which is often the treatment goal. Option D is a known, usually harmless side effect of nitroglycerin. The pearl, after invasive cardiac procedures, sustained or recurrent ventricular tachycardia must be treated as a potential emergency to prevent sudden cardiac arrest. Thank you.